Welcome to the American Nephrology Nurses Association's 50th Anniversary Podcast Series. In this commemorative series, past presidents and other leaders of the American Nephrology Nurses Association will provide a rich history of the association itself and of nephrology nursing as a specialty nursing profession. The American Nephrology Nurses Association's 50th Anniversary Podcast Series is brought to you by the Nephrology Nursing Journal, the official journal of the American Nephrology Nurses Association. We are honored to present this episode, and we hope you enjoy these invaluable and enlightening nephrology nursing recollections.
Hi, my name is Karen Robbins. I'm the Associate Editor of the Nephrology Nursing Journal and a past president of ANA. Today, it is truly my honor to interview Nancy Gallagher, who served as president of ANA from 1995 to 1996 and was a founding member of the association and a charter member of the Nephrology Nursing Certification Board, now the Nephrology Nursing Certification Commission. Nancy, thank you for taking the time to talk with us today about ANA and nephrology nursing.
Thank you for asking me to join you.
I'd like you to tell us about the beginning of your career and the environment in your early career in nephrology nursing, collegiality with physicians, your experiences with peritoneal dialysis, and how you got started in nephrology.
Well, I graduated in 1963, and 1964 and 65, I worked in the intensive care unit at Jefferson Hospital, or today Thomas Jefferson University Hospital. This is in Philadelphia, where we did a lot of peritoneal dialysis, 2-bottle hangs, and I participated in a research study for isolated ileal loop dialysis. We had a couple of young men who actually had the ileal loop isolated, still intact with the mesentery, but isolated to the skin, and then one end used to put dialysis fluid through and the other opening to remove the fluid. So that was kind of the busy time in the intensive care unit. I briefly served in the U.S. Navy Nurse Corps from 1965 to 67 during Vietnam. When I came out of the service, I went back to the ICU and was recruited to be a home dialysis private duty nurse for one of the patients that had been dialyzing there, and in addition was working as a home dialysis nurse at Crozier-Chester Hospital in Chester, Pennsylvania with Lois Foxen. We used 100-liter tanks, Milton Roy's, Drake Willock, Keels. During this whole time, the greatest experience I've had, I guess, was working with the physicians and learning. It was a new area of medicine, and physicians and nurses were learning together. So when problems presented, we approached them together, trying to find solutions or at least some way to help patients. During this time as well, I contracted hepatitis. This was from a patient who had been in the ICU in hepatic coma. I was stuck with the needle, but the urine from the patient was sent to the renal unit, which was around the corner. Subsequently, all the personnel in the renal unit, as well as the patients, became positive, and I became positive having been stuck. This was presented in a paper through JAMA, J-A-M-A, I believe early 1969. It was called the Australian antigen, which is now known as hepatitis B. We sort of got through that. I think the patients did not get sick, but the staff became very ill. 69 to 72, I went to the Ohio State University, and it was a unit, a dialysis unit that supported the transplant program. Again, we worked very closely with not only the nephrologists and nephrology fellows, but also the transplant surgeon. And we also had an acute program there. So we learned a lot. It was a small 4-bed unit, which soon outgrew its borders because there were more patients than what we could dialyze. So with the help of the Central and Southern Ohio NKF affiliate and Betty Crocker coupons, I started a home dialysis program using Travenol RSPs for patients in that area. That was kind of a unique experience, and there was a lot of growth for me during that time. From 72 to 74, I opened the first for-profit unit in Houston that was recommended by Dr. Wadisuki. And then from 74 to 85, I worked with Dr. Tankoff at the Northwest Kidney Center. Again, this was a really big learning experience for me because I worked with him doing peritoneal dialysis and fully automated equipment. So we not only went through 4 models of physio control machines, but also still use the University of Washington cycler for home peritoneal dialysis patients.
So this was a big advancement from the use of the big, I believe they were 2-liter glass bottles.
Oh, yes, and infection rates went way down. We could tailor the peritoneal fluid. It was an interesting experience because the University of Washington could make their own fluid at a neutral pH, where national companies could not do that. They had to be approved by the FDA, but because it was a pharmaceutical item from the University of Washington, we could have a neutral pH for those fluids. So the patients really benefited tremendously from that experience. The entire time from all through that work experience, it was great because my colleagues and I, had the opportunity to work directly with physicians. And again, as I mentioned before, have the benefit of learning with them, asking questions, trying to solve problems, not necessarily solving them, but attempting to solve problems. But it was a collegial atmosphere and one in which we all grew.
Well, it's just so interesting to hear how different things were, but how that has all led to the technology and the procedures that are delivered today. And it's just so wonderful to hear that evolution, and from someone who was there and lived it and contributed a great deal to it. So let's move along and talk about some of the things that happened during your presidency of ANA.
Well, I think that one of the biggest accomplishments was the increase of the first time the membership, ANA membership, grew to more than 10,000 members, 10,005 actually. We also created a position of ANA research consultant to help move the organization toward research-based nursing practice and nephrology nursing. And there was an effort to increase nursing roles in legislative activities at the state level to help with the delivery of care. Those are pretty much the main advantages or main moves that we had during my presidency.
Let's move now to what I know is your passion, and that's certification. You were among those who actually started the Nephrology Nursing Certification Board, now the Nephrology Nursing Certification Commission, in the 80s. If you'd share with our listeners how that came to be.
The idea for putting together the foundation document upon which nephrology nursing could be built came through Jerry Biddle and people earlier. I think Donna Mapes was also involved with that. But the idea of having a core curriculum, a scope of practice, and certification for nephrology nurses would be the three major foundations for developing nephrology nursing into a real specialty. When Janelle Parker was coming into the presidency, she pulled together Patty Jordan, Betty Crandall, Evelyn Butera, and myself as an ad hoc committee from ANNA to look at developing the first exam, a certified nephrology nursing exam, in an effort to institute certification for nephrology nursing. The core curriculum came out, I think it was either during Janelle's term or just prior to. The scope of practice was also being worked on, or it may have been already in place. I don't recollect exactly when those pieces came to be, but those were the three foundation elements for nephrology nursing. Within a year, we had an exam ready to go, piloted it at an ANNA national meeting in 1987 for 200 people, and then launched the exam as a real exam in September of 1987. And we became separately incorporated from ANNA in September of 1987 as the Nephrology Nursing Certification Board. I served on that board until 1995 when I was elected, when I moved into the president-elect position for ANNA. But as president, served as an ex officio member of NNCC and also served on the board as a past president of ANNA in 1996, 97. 97 through 2003, I served as president of the NNCC. I brought Janelle back on as education director and ultimately as executive director in 2003, where we changed the name. Actually, the name change came about around 2001 when we realized that we needed a second exam for nephrology nurses. The scope of practice surveys that we had done indicated that nurses were just all entering through outpatient dialysis facilities, and the need to focus on the dialysis patient more so than just the broad scope of nephrology nursing became pretty evident. And so there were changes that were made, and the Nephrology Nursing Certification Commission became a reality in 2001. At the end of 2003, in August of 2003, Janelle, unfortunately, was killed in an auto accident, and the board brought me back on as interim executive director, which was made permanent the following year, and I have served in that capacity ever since. It has been just a tremendous experience working with technicians, nurses, advanced practice nurses in all aspects of nephrology nursing. We had the challenge, of course, in 2008 when the new conditions for coverage went in and mandated certification for technicians. We were testing thousands of technicians between the end of 2008 and 2010. And we still have today approximately 35,000 technicians who are certified through the NNCC. So it's been an amazing experience. Unfortunately, what has happened is that nurses are not as ready to certify today. There are several reasons, I think, that have contributed to this. Number one, the nurses, as we found in surveys and looking at test results, nurses appear not to be as educated today as they were in the past. Over time, the amount of basic education for nurses has diminished. The technicians are being educated simply because that's required for certification and mandated by the government. But nurses are not mandated to be educated in nephrology nursing, to be certified. And so we have had an increase in the failure rate, particularly for the CNN, which is a very broad-based examination. We've seen a change in knowledge, skills, and abilities piece in our 5-year surveys. We survey all of our constituents every 5 years, and we've seen a decrease in the knowledge base for basic information in all aspects of, or in every category of nephrology caregiver. So it's been a real challenge to help nurses and technicians to find ways to become educated. There really isn't basic education out there for nephrology nurses, except probably through the ADC at this point in time, the annual dialysis conference, which does provide a basic track for nephrology nurses.
Nancy, I'm reminded of some of the things that A&A has done historically with respect to education, and specifically I'm thinking of the learning institutes.
Yes, they did. At the end of 1975 and all of 1976 and into the beginning of 77, A&A had a group of people. It was a 2-day program, a group of people that traveled all over the United States to promote basic education in nephrology nursing, and it was called the Learning Institute. And so all aspects of nephrology nursing were presented at that time. I did the peritoneal dialysis section, but there were many of my colleagues who were doing anatomy, physiology, hemodialysis, the pathophysiology, and I can go on and on about the various pieces required for good education. But it was a very successful program.
I remember I was involved with the transplant component of that, and they were great. And I guess one thing to point out here for our listeners is that NNCC's mission is certifying and not educating. And so
That's
the
correct.
education piece really falls to A&A, which is why NNCC had to separate from A&A and become a separate entity, because we couldn't be the provider as well as the certifying body.
Right, and that was required by the American Board of Nursing Specialties, which Janelle, by the way, was the first president for that group. It was a group that was formed with the help of the Macy Foundation, I believe, supported by funding from the Macy Foundation, to promote specialty nursing practice and promote the baccalaureate as the basic credential for specialty nursing. But they have a requirement in order to be nationally accredited through the American Board of Nursing Specialties. a certification organization has to be separately incorporated, completely separated from its professional counterpart so that there's no undue influence on the part of certification creation or certification examination and program creation. And so we are a separately incorporated organization. We do, however, promote all of the educational programs through ANNA. We disseminate information to our certificates regarding educational programming that's coming up through the American Nephrology Nurses Association, the National Kidney Foundation, the Annual Dialysis Conference, the National Association of Nephrology Technicians and Technologists, NRAA, the National Renal Administrators Association, so that they have an opportunity to know where programs are being held and that they might attend to get continuing education in nephrology.
Nancy, as we wrap this up, do you have any final thoughts you'd like to share with us or any reflections?
Oh, I guess only one, that I really wish that there was a better educational process for new nurses coming into nephrology that was stimulating and would hopefully then hold them and help them to stay within nephrology nursing, that it would create an atmosphere of wanting to know more and wanting to help patients who have end-stage renal disease or chronic kidney disease, both before and after, or before and during dialysis. But it's a little distressing to know that we don't have a good program out there for new nurses coming into our specialty so that they might enjoy the same opportunities that we all had early on.
Nancy, I really can't thank you enough for all that you've done for nephrology nursing, for ANNA, for certification. You have just been amazing, and your contributions can't be thanked. I can't thank you enough. So thank you for your time. Again, I've been speaking with Nancy Gallagher, ANNA president from 1995 to 1996. Thank you so much for your service to our specialty, Nancy.
Oh, you're welcome.
The American Nephrology Nurses Association's 50th anniversary podcast series is brought to you by the Nephrology Nursing Journal, the official journal of the American Nephrology Nurses Association. This series is owned and produced by the American Nephrology Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. For archived episodes of this podcast and to learn more about the American Nephrology Nurses Association, visit the association's website at annanurse.org. You can also subscribe to this podcast on iTunes, Google Play Music, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services.